One of the neat things about the hospital is it's been here for so long. It's been in existence for 100 years and on Locust Avenue for 75 years. I've been here for 26 years and I've seen the longevity of the hospital, and I believe it's going to be here for a long time to come.
This community made it known to us that they needed a hospital here. I think when you look at a community, one of the things you're looking for is health care and schools, education. You know, we're glad to be here for the community.
I think Fairmont Regional Medical Center, as it is called now, is everything to this community. And it has been referred to as the heartbeat of Marion County, and it is. It's a huge employer, and it's imperative that Marion County has their own hospital.
I'm blessed to actually enjoy what I do, and I've been doing it for 26 years. I joined the Radiological Physicians Associates, which at the time was a 7-man group, and over the years we've grown to have 20 radiologists. It's been interesting. As a radiologist, you know, I don't see patients in my office or in a private office. I'm here at the hospital all the time. But after you've been here for 25 years or so, people in the community know you, and they'll stop by after they get an X-ray and you know, come in and want to see it, and I'll go over it with them. So it's a real homey sort of a feel for the patients that do know me, because they sort of get a little special treatment that you might not get elsewhere in bigger facilities where you're not as well known in the community. I know 4 of my children have been delivered here, and it makes it very convenient. And we get good quality care. So that's the essence of a community hospital, is that the people work at the hospital, live in the community, and the people from the community can come to the hospital, get good service, and then return to their lives.
The chamber and the hospital go back a long way, and we have always been great partners. And I think that's why our relationship is so good, is that it has truly been a partnership over many, many years. And we have experienced the same ups and downs as Fairmont Regional Medical Center has experienced, and we've lobbied for them, and this chamber has traveled everywhere from Charleston to Washington, D.C., meeting with our elected officials in fighting for our hospital and making sure that we have a healthcare center in Marion County for the needs of all of our citizens. My father, who is now deceased, was on the board of directors Fairmont Regional Medical Center many, many years ago. During that time, you know, that was another turbulent time for them, and they came out of that very successful, and he was always proud of being a part of that. His whole life was in healthcare, so he dedicated his life to healthcare. So from the time I was a little girl, when he was on the board of Fairmont Regional Medical Center, to the time when I had all 4 of my children, I have 4 boys, all 4 of them were born at Fairmont Regional Medical Center. So it's always been a part of my life.
I started at Fairmont Regional Medical Center in 1979. I've been here about 37 years. I started as a staff nurse, and I've worked up through the ranks, so to speak, and have been in staff development, director of patient safety, an assistant vice president of patient services, a vice president of patient services, and I still remain the CEO today. I have been impacted by the care that this hospital has given. I actually had a relative who had actually coded here and was brought back and is doing fine today. As a matter of fact, that's my sister, and she works here. So every day I see her, I'm thankful, and I'm thankful for the staff for doing what they needed to do so she could be here. The Electo team has been instrumental in helping us make a turnaround. We are just in the beginning stages, but it is happening. We can see new changes every day. Electo has invested so much into our community, and I speak not only for myself, but for all the employees here, that we want to do our best to live up to their expectations.